Hi, my name is Dr. Kirmani, and today I will be talking about epilepsy. This video will give you information about epilepsy, its causes, symptoms, convulsion, seizure first aid, its triggers and diagnosis, along with the treatment of epilepsy, what's the outlook of this disease and its implications. Now let's begin with finding out what's epilepsy. Epilepsy is a neurological disorder where there is a fault in the complex electrical circuits of the brain and nervous system. Now, this may result in brain being unable to work properly for a brief period. Epilepsy is a term that indicates that an individual is at risk for recurrent seizures. It can be generalized, where the whole brain is involved, or focal, where only a part of the brain is faulty. Epilepsy affects all age groups. Now, about the causes. 70% of cases do not have a known cause, and it's called as idiopathic. The remaining 30% can be due to some problems in the brain, such as stroke, cancer, tumors, head injuries, which is the most common cause due to road traffic accidents, infections of the brain like brain abscess, meningitis, or tapeworm infestation. Now, in babies, it can be problems related to birth injury or babies born with congenital malformations like Down syndrome or cerebral palsy. The main symptom of epilepsy is convulsion. Well, other than that, people can also have unusual sensations, and in children, absent seizures are the most common type, where a child may have a blank stare, will have lip smacking, and twitching around the mouth. Many children complain of feelings of anxiety in the stomach. Now, how does a convulsion look like? Typically, it's divided into three phases, depending upon the events that happen. Something that happens before is called as aura. During the convulsion is called as ictus, and the recovery phase. Now, during aura, a person may feel sick, nauseated, irritable, and restless. Then, during the convulsion, they suddenly become unconscious and fall to the ground. Their body will have jerky movements, and they may have tongue biting with loss of bladder and bowel control. This may last for a minute or two. There will be a recovery phase. During recovery, they will still be forgetful and will be drowsy and may want to sleep for a while. Now, witnessing a seizure can be frightening, but knowledge of seizure first aid can save someone's life. So you can help them by the following. Clear away dangerous things like sharp objects or hot liquids around them. Loosen any clothing around their neck, such as a tie or a scarf, or undo the buttons of the shirt. Protect their head by placing something soft under their head. Note the time when the seizure started. It usually ends within a minute or so. If it goes beyond 5 minutes or another seizure starts, call for help. When the seizure stops, roll them to their side with their chin up to clear the airway. But there are certain things one shouldn't be doing while a person is having a seizure. Never move them, lift them, or restrain them. And do not force anything into their mouth. There are a number of triggers that can bring about a convulsion, such as when a person is sick, does not get enough sleep, skips a meal or a dose of medication, a person is under stress, is exposed to flashing lights, or has got some anxiety like puffing or hyperventilation. Now, if you've had a convulsion, it's important to see a doctor. Why? Because you may have another convulsion soon. Also, you need to find out the diagnosis and the cause of the convulsion. Now, what to expect at the doctor's place? Doctor will take a detailed history about the convulsion, the events that happened before, during, and after. So, someone who has witnessed a convulsion will be able to explain in detail. This will give a clue to the diagnosis. Apart from that, the doctor will do a thorough neurological examination. They may run some tests like blood tests to check if your kidney and liver are normal, and will also find out your blood sugar level and levels of your electrolytes. The doctor will order an electroencephalogram and an MRI. If the EEG and MRI are normal, it does not exclude the possibility of epilepsy. Once epilepsy is diagnosed, it's important to start the treatment because undiagnosed epilepsy and untreated epilepsy can be dangerous as it can cause sudden death or it can lead to long term cognitive impairment. The treatment is mostly by medicines, and modern anti epileptic drugs are quite effective in controlling the seizures. So the doctor may try a single drug first, and depending upon the response, they can introduce another drug. So a combination of drugs can be used. Patient compliance is so important in managing convulsions. So one should never skip a dose, should not stop the medication on their own, and while on medication, maintain a diary. You may have to take the treatment for at least 2 to 3 years or even longer. The aim is to have a life free of seizure with the minimal or no side effects of the medication. Now, most of the patients respond very well to the medical therapy. Only a small number of people do not respond to the medicines. Surgery is another option for them. Vagal nerve stimulation, an implant is placed which will control the electrical impulses of the brain. The other one is a resective surgery. The doctors will do a brain mapping and will locate the area that is at fault, and if it is safe to operate, they will remove a small part of the brain tissue. The surgery has got excellent results with a complete control over the seizures. There are certain implications of this disease on driving, employment, and sports and leisure. Most people with epilepsy can drive if they do not have a seizure for 1 to 2 years. Regarding employment, they can hold most jobs, and today many people with epilepsy are occupying high positions in the corporate world. However, careers are not available in certain services such as police, military, aviation, or public transport drivers. Now, regarding sports, most activities are fine, but people with epilepsy should avoid dangerous sports such as scuba diving, hang gliding, parachuting, rock climbing, car racing, and surfing. What's the outlook of this disease? Well, with the modern medication, one can expect to have complete control over their seizures. They can expect to lead a normal life. They can marry and have normal children. And remember, many famous people also had epilepsy, like Julius Caesar, Agatha Christie, Thomas Edison, and Hantel. That's all for today. Bye for now. See you next time.